Hey there, I'm going to be leading let's see, I can pause this for now, one moment.
All right. Well, hello everyone. I'm Dr. Jeremy Sines. I am the webinar chair for Division 18 VA section. I just want to welcome y'all and thank our wonderful presenters today. I know they took a lot of time and effort to talk about this topic today. One of the things that I want to do is general housekeeping before we do start is some general housekeeping with, we do have the question and answer feature enabled in Zoom, so you can submit questions. There are no CEUs for this current webinar. This will be recorded, like we just got the notification, and be put on our YouTube channel should there be anyone that wants to watch it. So be on the lookout for that. It does take us a little bit of time, so it's not instantaneous. I do want to have our presenters go ahead and ask them to introduce themselves if they will, and we'll move on from there. We will take some pauses during this time if we see any questions and answers. I'm sorry, so any questions. As far as the presenters go, would you like us to pause for each question, or do you want us to wait for a certain time?
I think it's really free flowing. So it's really what's most helpful to
Okay.
the attendees.
All right, so if I see any questions pop up and y'all don't see them, I'll make sure and bring it to your all's attention then, okay? All right, so if the presenters, if you will, if you could introduce yourselves, it would be greatly appreciated.
Hi, I am Shiloh Jordan. I'm the psychology training director for internship and postdoctoral residency in Honolulu, Hawaii at the VA Pacific Islands healthcare system.
I'll go next. I'm Jamila Jackson. I'm the Deputy Associate Chief of Staff for Education at the Dallas VA, and I was training director at the Dallas VA for 7 or so years up until last year. So excited to talk about the possibilities of applying for VA internship with you guys today.
Hi everyone, I'm Dr. Zoe Proctor-Weber, calling in from sunny Florida. I am the training director for internship and the postdoctoral residency programs here at Bay Pines.
Hello, everybody. My name is Nicole Levy-Minzy. I am the training director here at the Vegas VA. We are also sunny, but we are extraordinarily hot.
Hello, I'm Joanna McCormick at Montana VA. And well, I guess I'm a little bit north for many of you. We are Montana VA healthcare system. So our VA has the entire state of Montana. We have an internship program here. So nice to meet you all.
All right, well, thank you all very much for introducing yourselves. So without further ado, I'll leave it in your hands to start the presentation.
So I think I'm up first. That correct, Jamila?
I believe so. You're a pioneer.
All right, sounds good. So I just will give a short overview of VA culture, and it's really intended more to give us just a jump start to providing you as much helpful information today as you consider application for an internship within the VA. And one thing to note about VA is a very large government system where we have our own secretary in the president's cabinet. But at the same time, there's a lot of individual variability within each station. So there's a saying that if you've seen one VA, you've seen one VA. We share policy, we share electronic medical record. There's many things that we share in common. And as you're thinking about a VA internship, I also think it's important that you're really thinking about the culture of the individual site as well, because this will be highly variable. both in just the geographic location of where the VA is located, as well as just what is some of the typical practices within the VA, what's a little bit more normative and what's a better fit for you as well. I like to say that I'm a medium to small VA type of psychologist versus a super large system. So there's variable types of settings and sites all within the greater VA umbrella. And we're part of VHA, which is the health administration portion of VA. And we are a huge government-run healthcare organization that's very mission-driven. And the mission does include training and research, and really primarily serving healthcare for America's veterans. When you think about VA as a good fit for your future training, it would really be important to self-reflect on whether working with veterans and providing a service to veterans is of importance to you. And it would be okay if you've had no experience or exposure in working with veterans or knowledge of military culture. That's expected in entering an internship. It's more important actually that you have a desire to actually work with the population and in our terms, really serve the population as well, and find this to be an important endeavor. Each of us choose to work in VA for a reason. I know me, there's a point of pride that I have that's very special opportunity and a gift to be able to work with and to serve the veterans that we work with every day. And so this wouldn't be a point if you don't have VA experience or you don't have exposure to military culture. What's most important is the desire to work within the setting and the desire to serve the population. The other thing to really keep in mind is when you have a huge bureaucracy, this requires some flexibility and patience. And it may mean that you don't always get what you want, that you might say, well, wouldn't we want to just do it this way? But think about it, it's more than just like trying to move the Titanic. It's like even bigger and trying to steer and move as well. So it's where you're part of a larger system that would have its own rules and policies, and some that are even overlapping and different departments within the larger organization as well. So there are certain things that if you've been at other settings, that it may not be as big of a deal as your tour of duty. In the VA, it is. You start and end during your tour. So there's not a flexibility that I know I loved in grad school of kind of like, oh, okay, I'll work on this from 12 a.m. to 2 a.m. because that's when I'm up. It's really, you're working a tour and you're working in a more structured, different setting than maybe some of the other, I know, community settings in which I had done some of my training as well. You're also going to be a part of a bigger system that sometimes is under a lot of scrutiny. So in everyday private practice, you maybe would answer to an insurance body, or you may answer to your patients. In a VA setting, there's a lot more oversight, scrutiny, everything from the Office of Inspector General to then, of course, Joint Commission. And if you're in a rehab program, CARF accreditation. And then also within psychology training, we are all APA accredited or in process of achieving APA accreditation, and also follow all APIC membership criteria. So there's just a lot of layers of consideration that we look at within our VA psychology training, which I think for the trainee can feel like, oh, there's a lot of rules. For me on this side of it, it's really like there's a lot of accountability and there's a lot of assurance that we just have an obligation for providing high quality training and high quality care at the same time as well. I think it's incredibly meaningful to do the work that we do. And I think it's also important to say, is working in a larger healthcare system something that would really enhance my education and training? From our perspective, obviously we're here providing the webinar, it would, but I think it's important to really think about, and as you're looking at your internship application, to think within each public material, within each potential application, what does this individual VA site offer? What is unique to this site? as part of the bigger, greater VA system that will have certain rules and layers that may be different from other community organizations as well. So happy to answer additional questions as we go along. I'll be monitoring the chat since I got to go through first, and then I'll hand it over to our next speaker to provide some more information.
I think that's me, right? Okay. I get to talk about why would you want to consider a VA internship, a VA career? And I could talk about this all day, but legit, I think they're only going to give me 5 minutes and then they'll turn off my mic. So I'll start with the fact that the VA is really committed to training future psychologists. So committed, in fact, that we train most of the psychologists in the country. I bet almost anyone you run into that is a psychologist by career, they have spent some portion of their training within a VA site. And it's really nice that because training is such a focus and part of the mission of VA, the focus is on supervision, providing quality clinical training experiences and not on billable services. We also focus on measurement-based care. This is really nice as a trainee. We provide extra training in modalities that are evidence-based, driven by science. Depending on the site, there may be opportunities even as an intern to get specialized training in an evidence-based treatment like CPT or PE. In terms of stability, working within the VA and training within the VA is wonderful. The funding is stable. The funding for psychology stipends as a trainee is actually written into the national budget. And what comes out of that is, we put investment into our trainees and we'd like to keep them. So part of our training mission is to provide a pipeline for our hiring officials to hire career psychologists. The hiring officials really covet folks who come in with VA training. And there's so many jobs across the country in different geographical locations. Within the VA itself, you're going to have the option to have some exposure to all the different roles that a psychologist can take on as a VA employee. So of course we have the clinical roles where we're treating veterans in our evidence-based care, but you can also get exposure in different types of administrative roles, research roles, leadership roles, roles as a consultant. And during internship is probably the earliest point in time where these different roles and sort of the diversity and breadth in what you can do in terms of being a professional psychologist is really offered to you. I myself am a product of VA training, like many of the folks here on the call. I entered into the VA as an intern, had never set foot in a VA system before, but was really interested in this population and in being in a large, robust medical center. I stayed on and went through my postdoc in VA and then ultimately was hired into the job that I currently have. One of the nicest things about the career trajectory within VA is the ability to diversify what you do. My job is split up between clinical work and administrative leadership as well as research. And it just makes for a really balanced life, reduces burnout, and provides a lot of quality in the work that I do across the board. One of the other nice things about working with VA is, in addition to the stability, there are a lot of benefits long-term. Excellent healthcare benefits, ultimate pension if you stay in the system. Within VA, you can be licensed in any jurisdiction, so that provides you with the flexibility to move around. What else can I say? So In terms of your short-term sort of goals and your long-term goals, I think VA is a definite win. You get the quality training with the focus on supervision, and then many opportunities down the road to stay within the system with the flexibility of having different components to your job, as well as living and working in different geographical regions.
All right, I think we have a few questions. If I could ask some of y'all to answer. And I think some of these may have been answered, but do you have any advice for discerning differences between individual VAs other than reviewing internship information manuals and brochures?
I actually have some thoughts about this when I think about learning environment that you best thrive in. So it would be thinking about the size of the VA. What are some of the learning philosophy of the particular, like what do they describe as their approach to supervision and training, their supervision model? What are some of the specific rotation opportunities within that VA setting? Because that will be variable, because you could have, I know my setting located in the Pacific Islands will have a lot more rural care that we're providing, but we also, for example, aren't going to have an intensive on-island spinal cord treatment rotation. So if that was something really important to that particular intern, then our site wouldn't be the best. But if it's looking at wanting to really treat a range of veterans within a Pacific basin, well, we're it for you. So I think it would be looking at what is the learning needs that I have, what is the cultural environment I best thrive in, what are my edges, where do I want to kind of push myself, and where do I see myself thriving? What's the opportunity to be involved in bigger station things at this site? What's their approach and training model? I think those are all great questions. You can't always drive from a brochure, but you can in asking in the interview process as well.
Thank you very much on that. Any other people have any other advice about this question before we move on to a couple of the other ones? Oh.
I think I'll just throw one thing in there. I know that there's a question about searching for jobs afterwards. And one of the things that I would probably ask at any VA that I interviewed at was, what is your retention rate? How many of your personal VA trainees have you hired, or trainees from other sites? That'll give you a general understanding of particular locations' culture in hiring interns and postdocs that have trained there.
Thank you very much. As far as our next question, we have, is testing available to interns even if they are not on the neuropsychology track?
Yes, I would say yes. It's going to vary the level of testing experience that you get depending on the philosophy of how psychology is utilized at that site. But a part of all psychologists' functional statement involves assessment of some sort. So you will get assessment experience whether you're a neuropsych track intern or med track intern or general track, trauma track, all the tracks.
I think our next question is, how strict are the hour requirements? I know with COVID, I did not begin doing assessments until this year and will be a little shy from many of the sites I'm looking at hours.
I'd be happy to field that one. At my site at Bay Pines, traditionally, we've had pretty robust expectations in terms of the amount of assessment and intervention that a trainee comes in with. Since the onset of the pandemic, we are very much aware that the opportunities have been limited. What we're looking for is an enthusiasm and a desire to gain more experience in assessment. So while numbers may be low, that in and of itself isn't necessarily going to eliminate your application. If you can talk about your interest in going after more assessment training in your cover letter, that would be something that might be very appealing to training directors and those that are making these selection decisions.
And I think it's okay to reach out to the program to let them know about, you know, any disparities between what you are presenting with and what the requirements might be. So if the requirement is that you've done 5 of a particular assessment, but you've done 3 or 4, then they might be more flexible than if you've done 0, which is a different kind of category in terms of how the program is structured and what they're prepared to actually provide additional training in. So I think it's totally fine. I know as a training director, I fielded many emails about, I see your requirement is this, but I have this. And, you know, was always happy to address that directly, or yes, that we can work with that, or what kind of experience can you get before the end of the internship year that can set you up for success by the time you start. Because I mean, you guys are applying in the fall, you are coming on site on internship for almost a year later. So sometimes there are going to be opportunities for you to build up some of the skill sets or get some experiences that maybe you don't have in September, but you know, you can have by June.
Thank you all so much for some of your wonderful answers. I think I'd like for us to take a pause on some of the questions so that we can go through some of our presenters. Some of this information may be answered, but of course we will get back to the questions as well.
Cool, kick it over to Dr. McCormick.
Great. I think I'll add to what we're talking about here, which is how can we recognize and look at the materials that are available to us to determine, and would I be a good fit for that program, or what can that program offer me? What would I know to, what do I need to do to be the best fit for that program, or will this program be able to offer what I need to be a good psychologist in this field? What's interesting is that every VA is different than each other. So there's different populations. We're all serving veterans, but we have different population groups. Some places, depending on where the geography is or where people are located, you might have clusters of where we have younger veterans that are returning to college or school with young families, where you might be working with populations that are working with families with smaller children. You might also be working with populations that are older, with the older adult population, different needs from homelessness to a variety of challenges. So it depends on the area, the region, the VA, how big or small the VA is. And so there's differences between and within all of our programs. And so the brochure and the website tries to do the best job they can in describing what the uniqueness of that program. And so that is a good place to start. It's always, we welcome trainees and applicants that send us questions. We'd be happy to answer them, set up a little meet and greet before your applications are due if you have particular questions that you have, or introduce you to trainees and you can ask questions there about fit. One thing that kind of stands out for us as training directors is if you look at the brochure, take a look at what's in there, because if you send me an application with a cover letter that talks about your excitement to do research at Montana VA, I'll know that you really haven't read my materials very well. And this either is like a slip up in a template you've used with other VAs, because we don't offer a research opportunity at our VA. Our VA is smaller. We have what we call program improvement and quality improvement. So we have different types of experiences, but to use something called research, we don't have set time for research experiences. So that would be a piece to look at the brochure and the materials, and then follow up with a email or a call and ask specific questions, because that is where you will get the depth and the breadth of understanding. Because what a PTSD clinic looks like at my VA might look very different at another VA, and what the training experience might look like. So look at the materials and answer as much as you can in that cover letter describing you and the fit and whatever you're passionate about. So again, you may not have had a lot of experiences, but what do you want to learn from our VA, our training, in our staff that might be able to help you grow. So consider that as a place to help us understand you. And then when you come to interview, you'll be able to also ask us more questions. We'll ask you more questions. And another layer to understand fit, best fit for you, and so on. So that would be a little tip there.
All right, I'm going to pop in and I want to talk with you all a little bit about diversity training within VA. So multicultural training is one of VA's really large priorities, and there can sometimes be a stereotype that VA patients are this homogenous group, that it's all older veterans, that it's all male veterans, and that there isn't as much diversity as there really is. This was a surprise to me. I did my internship at the VA as well, the Dallas VA, and was really surprised at the variability in terms of the presentations that were there, not just the clinical presentations, but socioeconomic presentations were varied, as well as other things. So really wanted to take some time to outline that, or to highlight how diverse the patients that we see in VA are. We have patients as young as in their 20s. We see a number of women veterans, and those numbers are growing all the time. Lots of varied ethnic groups, varied ability groups, sexual orientation, identification, all of the things are available within VA training. I'd say one of the strengths about diversity training in VA is that because we are such a large organization, training directors within VA have the benefit of a number of shared resources with others that are doing similar work around the country. There are training director listservs where people can ask a question about, hey, we're trying to improve our training in this particular area. What are you guys doing? And training directors from all over the country will swarm and offer suggestions about how maybe they've struggled in that area too. This is what they've come up with, or they've got a system that works really well, and offer some suggestions. So VA training directors really have some wonderful resources in each other and the access that they easily have to what other folks are doing. Within VA, trainees are often surprised at the breadth of training experiences that they can have within VA. So because VAs tend to offer pretty comprehensive care, depending on where you are and what's offered at that particular site, you can really work with a number of different populations, a number of different presenting problems, because there are so many veterans that come through our facilities. There are a number of clinical presentations that our trainees get to see that are like once in a lifetime presentations of clinical things that you thought you would only read about, but they fall into our arms because we have such a vast population, and also a population that many of which have experienced some pretty extreme things, which can lead to some pretty extreme presentations in terms of how folks are managing and functioning. So again, as a national organization, you also have opportunities to interface with staff and trainees from around the country. The presenters are all members of what's called the VA Psychology Training Council. Don't get caught up in the details. Basically, know that that council has a number of subcommittees that are focused on different areas. Some are on diversity, some are on developing curriculum, some are on various different things to just help training directors within VA to manage their programs more efficiently, more effectively. And for many of those committees, trainees are eligible to be involved. And so if a trainee were interested in being on one of those national committees and was selected to be a part of that, then that's another great opportunity that you really can't get outside of a national organization, in terms of being able to learn from other people from around the country who are doing similar work and making an effort to do things to improve psychology training. There are several national initiatives that offer support and resources related to diversity for VA training programs. There's a quarterly diversity presentation that's sponsored by the Office of Mental Health and Suicide Prevention. Again, don't get caught up in the labels that will only confuse you, but know that there's a quarterly diversity presentation that's national, that's sponsored by central office, and always covers lots of amazing topics. I don't know if that announcement is bugging you. Okay, I think they're done. we get these rapid responses where it goes throughout the facility, throughout the hospital, and I see other people nodding their heads, and it's loud. And it's to let you know that, everybody needs to run to a particular area to help someone or something. But I don't run to different areas, so I just find it jarring. But anyway, there are national SharePoint pages that everyone has access to in our system that also include diversity, equity, and inclusion topics, resources, innovations that are happening at different facilities. So there's lots of support and encouragement for our training programs and for our psychologists and mental health staff writ large to really be thinking about and actively integrating multicultural perspectives into the work that they're doing. And so we serve a diverse population. We really try to aspire to recruit diverse trainees. And the VA's made some really concerted efforts to learn more about strategies to more effectively recruit and retain diverse staff and trainees. So if you're passionate about diversity, VA can really be a really great place to train. If you're wondering, I know there have been a number of questions around how do you distinguish between how one VA site addresses one thing versus something else. This is a great thing to ask questions about. So there are going to be some VA training sites that have diversity rotations of some sort. There are some that have a seminar series. There are some that have journal clubs. Everybody's going to approach it a little bit differently. And so that information might be in their brochure. It might not be. It's totally a fair and safe thing for you to ask them about so that you can learn more about what they're doing to promote diversity at their various sites. And with that, I'll turn it over to Dr. Levi Menzie.
Hello. So I'm going to talk to you about tips, tricks for the application process, for the interview process. Let's start out with some of the more basic things. Come prepared, do your homework, read the brochure, have a good case conceptualization outlined, have a case that you have fleshed out with a supervisor, that you know backwards and forwards, that you can really talk to us about from different theoretical perspectives, always using professional language and decorum. I don't know why I'm having to say this, but professional attire as well. I think anybody on this panel can speak to at least one or more instances in which folks have come to interviews in inappropriate attire. We'll just leave it at that. Even if it's on video, whatever is visible, please just make sure you look professional. I'd also encourage you guys to think about distractions in your interview space. I saw a question pop up about virtual interviews. In all likelihood, most sites will still be offering virtual interviews. I can't speak to VA as a whole, but I think for the majority of sites, we will be offering virtual. So that means make your space comfortable for you. Try to limit distractions as much as possible. Pets, others in the space. Feel free to use a virtual background. We acknowledge that we are being intrusive and the video is in your space. And so, we don't want to be intrusive for you as well. So please feel free to blur or use a background. And just make sure that whatever information you're sharing is on a professional level. I can tell you that when we were doing in-person interviews, someone had flown into Vegas and then had very casually but very inappropriately asked us where the best place to party was after their interview. So keep in mind that even those kind of questions are going to reflect on you. So just have that in the back of your head. Speaking to a little bit about what Dr. Jackson was saying in terms of cultural awareness and that case conceptualization that I had mentioned, be prepared to talk about a case from a cultural perspective, highlighting the patient's cultural factors, highlighting your own stimulus value in that interaction, how that impacted your own diagnostic considerations, how that just impacted that dynamic between you and the patient. Also being aware of self-awareness in terms of cultural sensitivity, knowing what you don't know. It's okay to not know everything. We're expecting you to come to internship ready to learn. So you don't have to know everything, but being able to say, I'm not entirely sure, let me look that up, or I had to go seek help from XYZ, that really speaks to your ability to know, I'm out of my league here, I need to go ask for help. All of us on this panel have been doing this for quite a while, and we consult with each other ladies, I'm going to say on a daily basis, I think. And so we want to hear that you know when to do that as well. Feel free to talk about that in your interviews. I think this has been brought up before, but I wanted to highlight specificity. When you are looking at different sites and you're reading brochures, you're fiddling around on the internet and looking at everybody's pages, really look at what it is about that site that draws you to apply. I can't tell you how often we hear, I just want to work with veterans. Okay, that's cool and wonderful, and we love that. But what about my site is a good fit for you? What about you, is making you a good fit for our site? Every site has a different flavor, so to speak. And feel free to reach out to training directors and ask questions. We're happy to field questions when you email us, or if you want to do a chat about, hey, this rotation has this experience. What can I expect from it? We'll happily talk to you more about that. Another tip I want to talk about is standing out. At some point during this entire selection season, all of us as sites are going to blur for you. And that's okay, because you're going to be looking at so many of us. There's hundreds of us. Keep in mind that the reverse is true. At some point, interns also blend. So make sure to look at that process from both sides. Make yourself stand out. We want to make ourselves as sites stand out, and we try to do that through our materials. Certainly our interview days, we will try to put on our show and tell you why we are amazing and why we think that VA is a great training program. I think all of us in this panel are products of VA training. We drink the Kool-Aid, so to speak, and we love it here. We want you to love it, but also remember that we want to see how you stand out and how you are a good fit for us. We want to be a good fit for you. We also want to make sure that you're a good fit for us. Looking at your application, I'd encourage you guys to think about a golden thread weaving through it. Your application and your interview need to make sense as a whole. Consider showing sites intention in your training plan and your goals. If you appear to be passively going along with whatever training opportunities are kind of tossed your way without seeking out opportunities that build upon each other, and your intern site being one of those in more of a logical kind of career-oriented path, does not really speak to a thoughtful progression as to becoming a psychologist. So really think of that golden thread weaving through your application materials and your interview. I believe one of my colleagues said this earlier, but in regard to the testing question, but I'm going to put it as a more broad statement. Honesty is the best policy when it comes to holes in your training. We know COVID happened. We were there. And we also acknowledge that some of you guys are coming to us from sites that might not have an abundance of practicum training opportunities. We know it's okay, but let us know, hey, this is a hole in my training that I really want to spend time on internship filling, and I think your site can help me with that. That might be testing. For many folks, it is. I think I saw a few questions on the chat. My testing hours are low, COVID, this, that, and the other. We get it. But tell us about it. Tell us how your internship year for you is a way to fill in those holes. Don't hide it, because we're going to figure it out. We're going to review your application and we're going to see it. So really just kind of talk to us about how internship can be helpful in improving whatever skill set that you have to work on. And I touched on this again, or before, but I want to say again, it really is about the best fit. Make sure that you're doing your homework of the placement sites that you're looking at, the rotation opportunities, the different supervisors. There are also so many learning opportunities within VA that are outside of rotations, whether it is diversity outings. Here in Vegas, we take you to the Air Force Base and we try to get you really plugged into what active duty life is like so that you understand what your veterans have experienced. All of those different opportunities, do your homework. Figure out and take some mindful reflection time to think of, where do I want to go with my career and what training site is going to be the best fit for that. That's going to make you have a much more successful internship year rather than this shotgun approach of applying to a bunch of different sites and just kind of, well, any VA is going to be a good fit. Sure, we love VA sites, absolutely, but different ones have different, focuses. So I'd encourage you to really do your homework there and make sure it's kind of like roommates. We both have to make sure we're a good fit for each other to have a successful year. I'm sure we've got some questions, so I'm going to stop talking. I don't know how we want to handle the questions.
One of the questions was around how can you be competitive for VA sites? And I just really want to underscore what Dr. Levi-Menzi was mentioning. I know whenever I would see applications and think, oh, this person's a great fit for our site, it was because they'd reviewed the brochure and they listed experiences that they had that were consistent with the experiences that they could build on at our site, or experiences that they hadn't had, but they saw that our site offered and it could fill the holes in the training site. So I think in order to be competitive, it's hard to say what can make you competitive for VA internships writ large. But for each site, I think really, digging into the 10 or 12 places that you're planning to apply, digging into those brochures and thinking about how do I connect the dots between the experiences that I've already had, the experiences that I aspire to have on internship, and highlighting those individual things in your application.
I saw one question about why do schools advise students not to apply if they don't have VA practica experience? And that, quite frankly, horrifies me. That's terrible. Don't listen to them. VA, we're a medical center. Our patients are complex. They have comorbid psychiatric and medical conditions very often. If you've been in another setting seeing equally complex patients, whether or not they're veterans or have military experience, this would be a comparable place for you. Let's see, university counseling centers, complex. Other types of medical facilities, complex. What might be a little harder would be if you'd only trained in a very small private practice settings. Might be a little more challenging to shift over to the differentials that would be necessary. But even then, you might be coming from an area that simply had very limited choices. So sell it to us. Tell us about how much you want to spend a year training with these complex presentations and learning these evidence-based treatments. We have something to offer, and we really do appreciate the enthusiasm.
Dr. Proctor-Weber, there was a question specifically about your research. Would you mind sharing a bit more about your work in research? Looks like what it looks like.
Wait, can you say that again?
It says, Dr. Proctor-Weber, you briefly mentioned that part of your current work includes research. Would you mind sharing a bit more what your work and research looks like within the VA?
Yes, absolutely. I didn't come to VA aspiring to be an academic researcher. I do like research. I like human subjects research. It's enjoyable, and I like training trainees in research. When I came to the VA, my first research position was sitting on an IRB, which I had zero experience in, but they provided training. They needed someone who was good at group. I was good at group. What they wanted was a psychologist to be on this review board that could really manage a large crowd of very diverse backgrounds, many disciplines, coming at research with many perspectives. That grew into a much better understanding for me of how IRBs worked, and then led me to developing my own large databases, which were then used for training purposes to run retrospective analytic studies. Hypothesis-driven, asking questions that are clinical in nature, and then answering them. So that is where I came from. In terms of the amount of time I spend in research, I would say at different points in my career, it's been about 30% of time. And it's something that I could have argued for more time if I had written grants and really decided, hey, I would like a large portion of my 40-hour work week to be dedicated to research. That's something that's available within VA. Personally, I'm a neuropsychologist, and I wanted more of my time to be clinically spent, so that wasn't an argument that I wanted to make, but it's out there, as well as administrative opportunities.
And I think it's totally fair if you're interested in having research opportunities while you're on internship to ask sites about that and the extent to which that's available. That's going to be available at some sites. It's going to not be available at others. And because sites are more clinically focused, that might not be something that they address in their brochure if they don't have a research requirement of some sort of project or something that they're requiring. That doesn't mean that there aren't staff doing research there, but that might just be something that, since it's not built into the program, you'd have to ask about.
I see one question about being a current practica extern at a VA and wanting to apply to the same program. Absolutely do that. You're a known entity. You take the can you play in the sandbox well with others out of the equation. We really are in a business to pump resources into burgeoning early career psychologists and then keeping them. I love to keep my own interns. I sometimes lose them to other VAs because of geographical preference. You know, we don't offer skiing here in balmy Florida, but always welcome them back as well. So I would not be afraid that that might look like you're asking for preference. The training directors are going to be very fair. They're certainly going to look at your skill set, but in many instances, having personal knowledge of interpersonal sort of comportment can be a real blessing.
Do we go through and read the questions
Sure.
and kind of answer? Jamila, do you see them there, or I can read?
Sure. So I'm going to go with the ones that are open that you haven't typed answers to. Okay. How strict are the hour requirements? I know with COVID, I did not begin doing assessments until this year and will be a little shy. So I think we addressed that question a little bit earlier. So I'm going to click answer. All right. What are some of the best ways current students can become competitive for a VA internship? I think this is something that we talked about a little bit earlier, but I think finding the match between your experiences and that site is really what makes you competitive. Dr. Proctor Weber talked a lot about the complexity of some of our patients. So even if you haven't worked in a VA system, if you can highlight experiences that you've had that would map on to some of the experiences that are offered at a particular site, then that makes you competitive. I think the main thing that makes people stand out as not being a good fit is not being a good fit. You have to think about it from the perspective of the training director. If this person has only worked with children and we only work with adults, then it's not that we're discriminating against them. They're just not going to have a good experience here because it's going to be too different. It's not going to be a good fit, a good match, and it's something that they might really struggle with. So that's kind of the perspective that the training director is coming from, is really looking at what are the experiences that they've had. How does that map onto? Is that something we can build from, or is it something that maybe is so different that I'm not really sure if they're going to be happy here, because we want the selected interns or the matched interns to be happy at the site, just like we were hoping to be happy with those that match with us. Anybody have anything else to add for that one?
I'd only add on, and this maybe goes into the next one about suggestions on how to make your application stand out, is I've noticed that when cover letters are overly generic, and it can tell that you just inserted the name of our site and it's the same cover letter being sent out to everywhere, it's really hard to tell why an interest in our site versus VA in general versus I just want to match so I can get my degree, which is fine, right? Like that's a really good reason to go on internship. Yep, it is a solid. And it makes your application stand out more when it really speaks to and why this site, because it says, I've really thought about this. I've thought about what you put in your brochure. I've thought about what I know about the site, and I've thought about what I need to grow in as an individual. So particularly for internship, and I would say true of postdoc as well, but it's really thinking about this is how I'm hoping to continue to grow, learn, evolve as a psychologist, and here's how your site would enable me to do that. Really enables your application to stand out. And I think feeds into being a more competitive applicant. So there's the basic experience of getting, if you haven't done a WACE, get that experience this year, be able to speak to, like, I'm going to get that. If I haven't done certain things, try to get that experience, not just so you can be competitive, so that you can be competent in your next steps and really have a good internship year. But then being able to, you don't have to personalize cover letters to the point that you're spending hours of your life in them, but really be thoughtful about, if your cover letter looks the same for every single site, then it will come across that way in the person reading it, because each site is different, even if they all are under the VA umbrella as well.
I add on to that, your question time after every interview, you're going to be asked, okay, now what questions do you have for us? And if your questions are largely generic, which the generic ones are good as well, ask those. But if you've done your homework and you've read the brochures and you've really been thoughtful and intentional about an application to a specific site, then your questions should also be specific to that site, the rotations, whatever it is about that site that draws you. So that same vagueness, try to address it with more intention behind your questions, as well as the cover letter and the application as a whole.
An internship it's a year of your life. You want to try to make a good match to the extent that you can. I can recall years ago preparing for internship back when travel was a thing. Just being in a hotel room, reading through the brochure and trying to figure out what genuine questions do I actually have? You've got questions. It's not all clear. We try to be thorough. We try to lay it all out there. There are holes. You have questions. So just really being intentional about, okay, for this particular people, what are things I want to make sure that I ask about? What would be important for me to have a good experience?
I can answer the question about non-training related experiences that stand out. I love to see anything that's over and above. Certainly you can do the bare minimum and just kind of glide through graduate school, and you get all the A's and you take the practicas that are required. But anybody that does more, I just find interesting. Maybe they've done more research, more posters, TA, maybe they've done some advocacy work, or they're active with their state organization. Maybe they volunteered for camps. I don't know, something that just shows me that, they're not just gliding through, that they're taking advantage of all the different learning opportunities, because that's what VA training does. You can get the bare minimum, pass the classes, get the grades, but there's so much here that can just vault your trajectory of a career. But you have to ask for it. You've got to want it. And anytime I see that type of trainee, definitely my eyes are wide open.
I was going to address sorry.
I just wanted to add that it's okay to talk about personal things if you want to share in your cover letter. So if you think about your application is the first step to get an interview, and then your interview is the icing to rank for selection. So it's okay to say something like, I've been to that area, I'm familiar with that area, or I'm from that area, I was raised in that area. At least for Montana, because we're so geographically isolated, that might mean something to our program in terms of fit. Whereas for someone that's like, I really want to live in an urban area and that's where I plan to go back to, that may mean something to someone else. So if it's a place that you want to hopefully go back or serve in your later years in your career, it's okay to talk about that, or how your family would, how would you be happy? Would you be happy in that location? Because that's also the success of your training year is your work-life balance too. In addition to your professional abilities of match and fit is, will you be able to sustain that ability to learn and do your best learning, take advantage of that learning year? And so it's okay as appropriate to describe yourself and what you like about the geography or the area that you'd be living in. So don't hesitate to share a little bit about yourself if that feels comfortable to you.
There was actually a question about work-life balance, which might be a good piggyback off of Dr. McCormick's comment. So I've been told that VA sites tend to have a better work-life balance for interns versus other kind of sites. I would absolutely agree with that. I think most VA sites have a similar tour of duty. We end between like 4 and 4:30, and you are really not allowed to take work home to do with you. So you're not going to be expected to work past your tour of duty. Those hours that you're with us and you're interning during the day, you're busy, you're doing stuff, you're chugging along, and we're going to keep you stimulated and busy. But when the day is done, there is an end to your day. Training directors are not texting you and emailing you and asking for things after hours. This is a really nice setup that the VA has created for staff and trainees, and we very much are mindful of those boundaries. And so and then if you're someone who has a family life, you know, children, whatnot, it can really be a nice fit because of the time of day things end, and that balance. So I'm going to speak from a perspective of someone who was an intern and is a staff member on both sides of the coin. I think the work-life balance is quite lovely within VA.
Yeah, and I think that that's an important question to ask because there are over 200 sites and so everybody's going to approach it differently. In theory, it is exactly what Dr. Levi Menzie said. But you really want to ask the program that you're talking to what their perspective is on work-life balance to get a sense of. I know at our site, if I get an email from a trainee at like 5 o'clock and they're supposed to be off at 4:30, then my response is not to the content, but why are you still here? What is happening? I know why I'm still here, but you don't need to be here. You know, we want that work-life balance. It's important. It's a priority. And that may not be the case everywhere. So I think that's an important question to ask. And it's totally appropriate for that to be on your mind. And you don't have to feel like, why are they going to think that I'm lazy if I'm asking about balance? No, it's a totally appropriate question. If they do think that, then that's good information too.
I want to take the time to thank all of our presenters. This presentation has gone by so quickly. You all had so many wonderful answers to the questions that you gave us. Now, that being said, I do want to pass on the mic to Dr. Rinker, who's going to talk to us a little bit more about Division 18 before we leave. Dr. Rinker, are you there?
I'll just echo what you shared, Jeremy. I mean, this is always one of the best attended presentations that we offer each year. And I want to thank each of the members of the VA Psychology Training Council for taking time out of their day today. I'm currently serving as the VA section's Secretary Treasurer. I'm with the VA Portland. And if you have any questions about the VA section, I popped a link to our website into the chat. Please consider looking not just at the resources we offer, but also our past webinars, including, I got to think 4 or 5 years of this topic being covered in the past, and it's just a wealth of information, not just for current VA employees, but also those who are going to become our peers in the future. So once again, thank you everyone for your time, and I think that might be a good place to end things for today.
Thank you all so much.
And if there's questions we didn't get to, you can feel free to reach out to us if they're still kind of on your mind. I know that there were some left over in the chat as well that you can always feel free to reach out to us individually. We're just a Google search away.
Good luck, everyone.
Thank you all.